Hello, and thank you for the opportunity to present some work today on new F18 and gallium-68 traces for PET myocardial perfusion imaging at the ANZSNM conference in Brisbane. Firstly, I just wanted to outline the rationale for using or for looking at new PET traces for MPI. Then I just want to outline the targeting and labeling strategy in this project looking at using phosphonium salts to target the myocardium. And then I'll just show you some preliminary results in this project and where we plan to go through from here. So why look at new PET traces for MPI? Well, as most of us might know, myocardial perfusion imaging or MPI scanning is done in most hospitals using technetium-99m cestamib or MIBI, and has other names. And it's used to look at normal and abnormal blood flow in the myocardium under stress and rest. The supply of technetium-99m in Australia is centralized, which means it's efficient, but it's also vulnerable to disruption, as we've become familiar with over the last few years. On top of that, in WA, we have a local supply of technetium prepared doses, which has been disrupted with some facility issues that have recently been cleared up. But on top of all that, there are some shortage of kits if you're a site that makes your own MPI tracer. And on top of all of that, there are some COVID-related flight disruptions, just making planning and imaging these patients quite problematic. This has been addressed in a number of ways. Firstly, it's possible to use thallium-201 as a SPECT alternative for MPI, but thallium supply has its own issues. It also presents a very high radiation risk to the patients. Some PET alternatives, they can be made available, I think in a recent Medicare item 61644, only when thallium is not available. Some other items allow for funding of a PET scan using flurpiridaz, but though in WA it'd be unrealistic to image the same number of patients that we're doing every week and expect for that tracer to be flown out into Perth, as it is unable to be made in our facility at Charles Gairdner. Other PET alternatives, rubidium-82 hasn't really taken off in Australia yet, and there is a lot of, I think there's a lot of rationale for looking at other alternatives that can be made simply and easily from locally produced fluorine-18 and gallium-68. Now, you should note that technetium cestamib accumulates in the mitochondria of cells for a couple of reasons. First, it's positive charge. There is a negative inside membrane potential across mitochondria, which, by the by, is elevated in cancer cells, which is the reason why cestamib accumulates also in sites of cancer. It is also a delocalized positive charge. It's shielded by lipophilic head groups. Last year at the ANZSNM, you might remember Alan Packard gave a really great talk on labeled rhodamines for myocardial perfusion imaging. Rhodamine, you might be familiar, is a very good dye for staining mitochondria. Looking at that in vitro, he's actually labeled different rhodamine compounds and looked at their uptake according to their lipophilicity, and this was just one compound he presented last year. The aim is to get high uptake in the myocardium, as you can see here around the heart, but also at the same time very low activity in the liver, and you can tune that by modifying the compound to have an optimal lipophilicity. Another class of compounds includes phosphonium salts. You can see here where you have an aryl phosphonium salt, so it's a delocalized positive charge. It's shielded by these aryl groups, and fluorine-18 in this case connected by a linker. And you can it is possible to image myocardium using compounds of this class, which is what this project is looking at. So collaborating with Lou Rendina's group at the University of Sydney, who has a brilliant postdoc, Leela Hill, prepared this simple phosphonium salt with a NODA macrocycle. And I've been looking at labeling that first with aluminium fluoride. So in this case, the aluminium fluoride is a good match for NODA, allowing one free binding site for the aluminium. But it's also possible to use this precursor to label with gallium-68, as you can see here. So first, let's look at gallium, labeling with gallium-68. Using a manual synthesis just to see if it's viable, but the buffer and the amounts of activity and the relative amounts of everything is just taken from the standard protocol for labeling gallium-68 dotatate. And you can see here the crude material is actually quite pure. I'm sorry, my head is obscuring the TLC results here. I can see, but you can see from the HPLC there is close to 97% purity, perhaps with the presence of a diastereomer here, but there's very, very little free gallium. And in this case, there's 3% free gallium. Scaling up using our iPhase multi-syn module, which we use for all clinical gallium runs at Charles Gairdner. From one generator, which yielded 710 megabecquerels, the final activity of purified compound was over 500 megabecquerels, which is an excellent conversion. And you might be able to tell from this trace the amount of trapped activity on the strata is pretty much the same activity that was in the reactor. And testing the purified product again, the HPLC gave excellent radiochemical purity, greater than 99%. And apologies for my head again, the TLC giving 99% also. Now, looking at aluminium fluoride labeling, this is a protocol that's taken from some recent papers where a small amount of fluorine 18 in acetate buffer to pH just above pH 4 is added to precursor, aluminium chloride, and it's heated in the presence of ethanol for 10 minutes at 90 degrees. And just looking at the crude material, giving a 35% or close to 35% conversion, so labeled product versus free fluoride here at the injection volume. I've been looking at scaling this up on a automated module. This is very much under development using one of our older modules, the MX, and a trial run using 4 gigabecquerels of fluorine 18 gave only 6 megabecquerels of product. I wasn't able to analyze it by TLC or HPLC, but there is more to come. I think it's quite important to look at scaling up F18 syntheses, particularly if you get to the stage of trials, just to cut down on extremity dose and keep everything as consistent as possible. To optimize the F18 labeling, looking at two things. First, the pH, just to confirm the pH of the buffer that we are using is going to give us optimum conversion. You can see here a pH of just above 4 is giving us the best conversions here. The blue dots represent reactions that do not have ethanol added, but in the presence of ethanol up to 50-60% by volume, our conversions are easily double or tripled. And so in this case, the best combination is pH 4 in the presence of ethanol. Second optimization I needed to look at is the purification of the crude material. So I decided to take a run that actually went quite badly, so in this case only 4% conversion, and seeing what different cartridges we could use to purify the product. So looking at a C18 set pack, light, so it has less material than the standard set pack C18. I think this is 300 milligrams of material versus 50 or 100. This is a strata Our C18 column, which we use for our gallium runs on the multisyn. And these cartridges are HLB cartridges. It's just a modified silica. And these are actually taken from some expired FET kits. And on advisement from some other recent papers for aluminium fluoride labeling, using 2 in tandem can give better results than just one. So if you know your material is only there in about 4% yield, so about 4% conversion in the crude material, then you expect to trap only roughly 4%. So you can see here from the first 4 cartridges, roughly 4, a bit more than 4, indicating that maybe there's some free fluoride in the silica bed, which makes sense as there's a lot more silica in this case. In this case for the strata, there's a bit less, maybe half of what we were expecting. It's indicating that the trapping may not be good using that, and HLB again around 4. But then after you trap it and you wash it and then elute off the product using ethanol or 70% ethanol, the purity of the tracer that you are obtaining this method is good, or getting there. In the case of these 2 cartridges, quite poor with the strata, and is really not optimal for the HLB. I'm sorry, I apologize for my head again, but the results are even worse with 2 cartridges in tandem. So just to summarize, so we have a successful labeling and purification of the gallium tracer. This seems to be the easiest front rudder, the easiest of the 2 tracers to progress, to optimize yield and look at some in vitro stability and perhaps some animal studies. Although the F18 tracer, though still successful, but it just needs a bit more work to scale it up and purify the product. We need to then look at planning and funding, of course, some animal studies just to assess if these tracers are actually useful at imaging myocardium and having a low activity in the liver as well, which is really important. And then we might be able to optimize uptake by looking at using different linker groups and aryl head groups around the phosphonium group, again in collaboration with the Rendina group. So with that, just like to acknowledge my team at Rapid, and as well as Rosemary Dallin at Nuclear Medicine at Charlie's. I'd like to thank all these bodies, UWA and the National Imaging Facility WA node, hosted by the CMCA at Harry Perkins Institute, where I am now based as a fellow, as well as the hospital, MedTech and Physics, Collaboration Rendina at University of Sydney, and as well as Curtin, who I have an adjunct position with. So with that, thank you for your attention.